as we said, Remy Shergill is the Campaigns and Communications Manager at the Climate and Health Alliance, Australia's peak body on health and climate change. And Remy holds a Bachelor of Science and a Master's of Environmental and Sustainability, and combines her passions for health science, climate change and strategic communication at Australia's peak climate health body. At CAHA, and CAHA has been mentioned a couple of times in presentations before this, she leads a program of work which builds public understanding of the link between climate and health and upskills health professionals to advocate for climate action. So over to you, Remy.
Thank you so much for having me. It's fantastic to be here, and I'm excited to hear that CAHA has already gotten a few mentions today. Before I get started, I'd like to acknowledge that I'm calling in from Wurundjeri country here in Melbourne, and I'd like to pay my respects to their elders past and present, and I'd like to extend that respect to the Gundit Mara people, the traditional owners of the country where you guys are gathering. At CAHA, we commit to listening to and learning from Aboriginal and Torres Strait Islander people about how we can better reflect Indigenous ways of being and knowing in our work. So thank you for the introduction. I love this job because it does combine a whole bunch of passions of mine: health, climate, and communications. And I'm going to just start off with a really boring bit of communications theory, but don't run away yet. Basically, the reason why I love working in this space is because health is an incredibly powerful way to talk about climate change. I care about climate change extraordinarily, but the reasons I care about climate change don't always resonate with people that are a little bit different to me. The good thing about health is that health is one of those universal values that really activates a large cross-sector of the community, regardless of, political affiliation or how you were brought up or socioeconomic status. It's a really powerful frame through which to talk about climate change. Many of us came to climate change thinking of it as an environmental issue. We now see, our young people really seeing it as an intergenerational justice issue, which it is. You can also see it as an economic issue or an investment opportunity or an environmental catastrophe. But talking about it from a health perspective is really, really powerful, and there's a role we can all play there. So I'm just going to share my slides. Bear with me. Share screen is loading. Great. So just for the record, I can see myself and my screen, but I can't see from in the room. So if there are any problems, just shoot me through a message on the webinar chat. But yeah, so I'm here with the Climate and Health Alliance, Australia's peak body on climate and health. Our mission is to build a powerful health sector which is able to achieve climate action and also make our own industry more sustainable. And we represent over 100 organisations across Australia, some big, some small, and which covers a large percentage of Australia's health workforce, which is Australia's largest workforce. So we work together with all of our members to help them to improve their own practices, but also to gather diverse perspectives to help decision makers make better decisions about how they can protect our health from the impacts of climate change. So I'm not going to talk too much about the science of climate change at all. This is an image that I love, which is basically all you need to know as background for this presentation. It's getting warmer. It's us. It's definitely caused by humans. Yes, we're sure. It's irrefutable. It's going to be bad, but we can fix it. There's a bunch of sources down there, but if you agree with that and you're coming in with that understanding, then that's a really, honestly, a solid place to understand the science from, and you're ready to talk about it in your circles if you are on board with all of that. Something that's a little bit less well known is that climate change is a really big threat to our health. So the World Health Organization has called it the biggest global threat of this century. We do hear about climate change a lot, but when it comes to health, the link isn't always there. Like when I'm thinking current health threats, of course, the biggest one that I can think of this century has been COVID. And COVID, many at the World Health Organization said was a test for what's down the pipeline when it comes to the impacts of climate change. So what sort of health effects am I talking about? Extreme weather events, impacts on mental health, on our food and water security, a spread of infectious diseases, more air pollution, and rising sea levels are some of the major causes. So what does this mean for Southwest Victoria? So I'm sure that people in the room can have noticed, how much more dangerous the heat is becoming. There is less rain in Victoria than years have passed, and the fires are getting more ferocious. Particularly in regional and rural areas of Australia, mental health of our young people, but also, our farmers, is really being challenged by changing climates. That extends into food and water security, and infectious diseases as well. I forgot to add it there, but people in regional and rural Australia are seeing an increase in some infectious diseases that used to be in warmer areas. But as the climate warms up, the mosquitoes and the other insects that carry those diseases are able to spread out and spread those diseases further. And that's not just diseases for humans, that can be diseases for livestock. So another sort of impact for our farming community. When it comes to air pollution, not only does the coal and oil and gas create the greenhouse gas emissions that is warming up our atmosphere, it also creates a lot of air pollution. So just from our traffic, just from our vehicles, recent studies have linked it to 11,000 premature deaths a year in Australia and 66,000 asthma cases and over 20,000 hospitalizations for cardiovascular and respiratory conditions. So the air pollution driven by burning fossil fuels is really significant. And when it comes to sea level rise, this is really, relevant for you guys in Warrnambool. The best science at the moment suggests that sea level rise will rise by 75 centimetres. Sorry, the sea levels will rise by 75 centimetres by 2100. I know that's probably hard to picture and maybe it doesn't sound like that much, but for every bit that it rises, it makes it much more dangerous during storms. So that 75 centimetre sea level rise could get to about 2.2 metres during storm surges. That's a huge threat, not just to people's homes and people's safety, but afterwards, does it affect, sewage systems? Does it make, the land unstable? There's lots of ongoing implications from that. So what can we do about this? I'm going to start here really briefly because what I'm talking about, it's going to affect Warrnambool, but it's affecting the entire world and it's going to require a global solution. And in Australia, we can look to our government to really have to lead on this. And so CAHA is calling for a national strategy on climate health and wellbeing. The Labor government during the last election did commit to one, and we are working with them to make that as robust as possible. So I want to start here because the onus on acting on this should not be on us to use our keep cup and take up, we shouldn't feel guilty because we're not doing literally every single little thing we can when the system around us is set up to perpetuate climate damage. So we absolutely need systemic action for this problem to be fixed. And we are seeing that progress, but we need a lot more. But there is still stuff that we can do in the health sector. We are Australia's biggest sector. We employ over 1 million people and we're highly trusted. When you look at the types of people that Australians trust, doctors and nurses are up the top, and that extends to other parts of the health sector. When the average Australian thinks of the health sector, they think of doctors and nurses, but It really involves everyone from physios to psychologists to researchers to, health decision makers. People really want to listen to health perspectives, and they see them as incredibly unbiased. So what are some of the things we can do in our own sector to contribute to this global push to reduce environmental harm? The first thing is we need to clean up our own sector. So our sector, vows to do no harm first. Yet we are a significant source of greenhouse gas emissions and other environmental harms like waste. We hear all the time about, incredible plastic waste in the healthcare sector. So at the moment, if I talk about emissions first, we produce 7% of Australia's emissions. That's about the size of South Australia. So it's a really big deal. And there's a lot we can do there to reduce those emissions. This is why CAHA coordinates the Global Green and Healthy Hospitals Network in the Pacific, so representing Australia and New Zealand. It's a sustainable healthcare network, which is actually plugged into this global network. So around the world, there are many, many health services and hospitals taking action on sustainability and climate, and they're all working together as part of this network to make sure that we're sharing information, tips, processes that can help us all get there faster. What this looks like in Australia, we at the moment represent over 2,300 hospitals and health services across Australia and New Zealand. And we have at CAHA, we basically coordinate these groups to share knowledge, share examples of what they're doing, and have working groups. So if you're working on pharmaceuticals, you can work with other people who are working to reduce pharmaceutical waste. Same with plastics, same with transport. There's so many areas here that people are already working in. And if you want to bring some of this to your health service, there's so many opportunities too. As part of the network, in the last year or two, we've had a lot of the health departments also sign up. So not only are we working kind of from the bottom up, from the health service, and the health services can connect with each other, encourage others to start implementing some sustainable practices. We're also working with governments to help them, implement this more systemically. And in each of the states in Australia and nationally, there is action happening in this space that you may not be aware of. In Victoria, there is a Health and Human Services Climate Change Adaptation Plan. And there's a Department of Health Environmental Sustainability Strategy. So getting the strategies are an amazing way to start, but we need to make sure that these plans are robust and that they're being effectively communicated to people on the ground, and that people on the ground are being supported to, implement action plans to reduce their own emissions. But I encourage you to, if you aren't aware of some of the sustainability practices in your area or in Victoria, I strongly recommend, Googling it and seeing what the government is doing. And if you see that there are areas where your service could contribute, to take that to some of the decision makers in your organisation. So in the network, we are trying to improve sustainability around these areas. A lot of our organisations focus on waste and energy because they're some of the sort of low-hanging fruit when it comes to improving sustainability practices. But we've also got organisations that are working on improving food sustainability, safely disposing of pharmaceuticals, but also picking pharmaceuticals that have a lower environmental impact, making sure that when new hospitals are built or new facilities are built, that they're done so in a sustainable way. And even things like, you know, if there's a new hospital build, how can we make it an all-electric hospital so that in the future it will be 100% powered by renewable energy, not stuck with, you know, using gas. So I just want to share with you some examples of what people in our network are already doing. So St Andrew's Memorial Hospital has established a closed loop recycling ecosystem, which is recycling more than 450 kilos of plastic healthcare waste each week. At another service in Queensland, they've introduced a room service style approach to patient meals, and which led to a huge reduction in food waste. Same reducing waste from occupational therapy at Melbourne Health. That saved $230,000. And here's the other thing, like, you might care about sustainability from a climate point of view, but your managers can care about sustainability from an economic point of view. These things do save money, because throwing things out or buying offsets or whatever it is, all these things cost money. So if we can connect sustainability to the bottom line, it makes it really easy for our managers and decision makers to get on board. Melbourne Health is also working with Oz Harvest to make sure that their surplus meals don't go into landfill, and that's reduced 17 tonnes of carbon dioxide emissions each year. Oral nutrition supplements. I'm sure some of us have had the experience where we give something out, it's not used, but you know, our protocols at our health service means that they're no longer considered sterile, even if they haven't been opened. So Cairns and Hinterland Hospital came up with a process that people were happy with to make sure that these things aren't being thrown out. Recycling plastics, single-use metals and syringes at Fiona Stanley Hospital in WA. That's diverting over 44,000 plastic bottles from landfill each year. Removing desflurane, same hospital in WA. Desflurane is an anaesthetic gas that is much more, which is a greenhouse gas, and it's much more environmentally harmful than some of the alternatives. And by removing this greenhouse gas, it's saving them $10,000 a month and is reducing 34 tonnes of greenhouse gas emissions every month. And we love this one as well from Fiona Stanley Hospital, making sure that Aboriginal and Torres Strait Islander patients have access to culturally safe and appropriate food. This was so popular that it moved from being an option for Indigenous patients to an option for everyone, and it's more sustainable as well. And, you know, our own Ambulance Victoria, they have really ambitious emissions reduction targets. So all of these groups are part of the network, and what we love to do is to connect organisations who are interested in making some of these changes in their own service with the people who have already done it, and talk about, how did you convince management? How, you know, what can you teach me about how much money it's saving, and what has the feedback been from your patients? These are really valuable conversations to have, and it's going to save us all so much time if we can if we can talk to the people who have already done it. So that's a bit on our Sustainable Healthcare Network. And I'm just going to talk a little bit now about how we, beyond our health networks, can talk about climate change and health in a way that helps other people care about climate change. So previously, that's what we could do in our jobs as health professionals, but what can we do outside of that to, you know, advance climate action? The research shows that personal conversations is one of the most effective ways of making people care about climate change. Most people in Australia care about climate change. There's a really small percentage of people who are outright deniers, but they're very loud. And so people are often intimidated or, you know, nervous about bringing this up. But the fact is that most people care, but most people think that other people don't care because they don't bring it up. So the more we can have conversations about this, the more we can normalize, caring about climate change and demanding action. Just a bit of context. We did this survey in 2020 of 900 health professionals to see how they are feeling about climate change. And some of our biggest findings were that they're concerned about climate change. About 50% of the Australian general population are either alarmed or concerned about climate change. Amongst health professionals, that's over 75%. So you can be pretty sure that your colleagues are concerned about this issue. And they say that they can already see the impacts on health, on the patients and the clients that come in. Some of the biggest impacts are from heat stress, harm from bushfires, that includes from bushfire smoke, and mental illness. There's an absolute mental illness epidemic in Australia at the moment, and climate change is particularly shown to be a driver of that amongst rural and regional communities, amongst people who have been affected by extreme weather, and pretty much amongst most young people who are worried about the future that they see coming. It's not just affecting the people who come in, it's affecting the services themselves. So about 30% of health services said that staff had been absent from work from being impacted by extreme weather events, that there was increased service demand. Some people couldn't access the health services because of the extreme weather events. So this is really going to affect our sector coming up. But health professionals say that they want to talk about it, but they don't feel sufficiently informed to do so. But if they're given the training and resources, they start doing it. So here is the training and resources, because in order to tackle this is a major public health threat, and it needs effective communication to address it. The best example of this quote that I can think of at the moment is clearly COVID. We've seen how poor communication costs lives in a public health emergency, and how good communication saves lives. So this is going to be relevant in the decades coming up for climate change as well. So if you're talking to people, it could be people at work, it could be your friends and family, it could be your local MP. Here are a few top tips for how to have conversations about climate. I'm going to go through these quite quickly, but at the end, I'm super happy to share where on the left, there's an image of our guide, how to communicate the health impacts of climate change. It's a really useful tool to keep handy. So keep your messages simple. Put people first. So by talking about the health, we're already putting people first. Speak to the values patients and clients care most about. So if the people you're talking to care about their kids, talk about their kids. If they care about their dog, talk about their dog. If they care about koalas, talk about koalas. If they care about justice, talk about justice. But if you know the person that you're talking to, talk about how climate change affects what they care about, rather than, say the polar bears on the ice caps. And if you really care about the polar bears on the ice caps, I get it, me too, but not everyone does. People see it as distant. Use climate impact moments to raise the issue. You will have heard, oh, we can't talk about climate change in the middle of a bushfire. Wrong. Yes, you can talk about it. Anyone who tells you you can't talk about it is probably a politician. Ignore it. That is the perfect time to talk about it. Introduce the health co-benefits of climate action. I have a slide on that shortly. And don't argue about the science. If people are, talking to you about, oh, but what about NASA doing this? And, I've heard it's all a hoax, whatever. Don't argue with them about the science. You won't win. They don't actually care about the science. You'll give yourself a headache. Just, this is related to the next one, stick to your area of expertise. You can say, I don't have the answer to that because I'm not a climate scientist, but what I can tell you is, I've seen more people coming in with heat stress as the climate has warmed. I'm not a climate scientist, but I know that the World Health Organization says it's a massive health issue. stick to your area of expertise. So if you're a health professional, talk about the health impacts. If you're an emergency services worker, talk about the impact on your work. If you work in local government, you can talk about how it's affecting your community, because you are already an expert on climate impacts in your own space. We can all see them. And if you're not sure what they are, ask your colleagues. People are aware of how climate change is affecting their work. Just for the interest of time, just because I think I want to allow a few questions, I might just skip through this, but this is just some of the resources that we have available to help health professionals to do this work. But this is really important. So tackling, not only is climate change a massive health threat, it's also a massive health opportunity. If we take action on climate change, we can massively improve the health of Australians. So for instance, cycling and walking, really good for our health, really good for the climate. Eating more plants and less meat, really good for our health, really good for the climate. Getting gas out of our homes, getting it out of our kitchens, getting it out of our schools, removing gas heaters is really good for our health and really good for the climate. So if we talk about climate change in this way, not as, the doomsday apocalyptic vision, but as an climate action giving us an opportunity to create healthier populations, that really is persuasive for a lot of people who maybe switch off when they hear about the doom and gloom. I think I'll leave it on this. This is one of my favorite little comics. There's so many benefits to climate action. Better jobs, preserving rainforests, renewable energy that doesn't require us to dig anything out of the ground, healthier children who don't have to worry about what their planet is going to look like in 50 years, and if they can get a good job and if they can have their own kids. Even if climate wasn't real, these are like amazing things to aim for. And so climate change is irrefutable, but the best thing is that when we tackle it, the benefits of it are really just going to create the kind of world that we've wanted for a long time. Like before this even came about, people want good jobs, people want livable cities, people want healthy populations. So climate action is actually a really big opportunity to get there. So I would just really encourage you, particularly if you're a health professional, to get in touch. This is my colleague Stephanie Carino's details, but you can just go to the CAHA website and send us a contact request if you'd like. It's a free network to join, and you can be connected to all sorts of people who are doing this work, who are really experienced and have a wealth of experience that they'd love to share. So really encourage you to get in touch and tap into those resources. I might stop there. I actually can't see you, and I'm sorry, I'm not getting feedback from the room, so I'm not sure if, if there's any feedback coming from the room, but I guess, I'm available for questions. So I'll stop there.
Thank you. Thank you, Remy. Yes, I'd like to invite questions. Anybody from the floor?
Remy, thank you for tapping in. Remy, it's their costs. I know that we had conversations about very small rural centres. A lot of people that have been given the job to introduce climate change into health services are on their own.
Yeah. Oh, sorry, it cut out there, Nikki. Sorry, I'm not hearing anything from the room. I heard Nikki talk about how people are on their own in rural health centres.
Sorry. Just the small rural health services that have got only one person working in this. Yeah, so thank you for that.
Oh yeah, and honestly, I think that they're exactly the services that can really benefit from joining the network, because there is no reason to have to figure this stuff out on your own. People have figured it out, and you know, this is such an urgent problem that we want to avoid as much of reinventing the wheel as possible. We've got resources ready to go. We've got resources that you can adapt. So please do get in touch, because you know, this is too urgent for us to sort of spend a lot of time trying to figure it out. And it's really normal for health services to basically find a passionate person. You know, we're all really stretched, but it's really normal, not just in health services, in all sorts of organizations, that sustainability is left to the people who care, and they're expected to kind of do it on top of their normal work. And that is really tough. So of course, we really recommend that health services, where they've got the resources, you know, give people paid time to do this work, but you can also, you know, lean on groups like CAHA and this network to help access some of those resources and make that mission, you know, a lot smoother.
Excellent. Thank you so much, Remy. A round of applause for Remy. Thank you for joining us today. Excellent presentation.
Thanks.
All right. Since we have a little bit of time, what I thought we could do is, Linda, if you could read out some of the actions that, or some of the ideas that all of you have put together today and put them on the wall. So if you could read them out before we go to our next presenter.
Okay, so Remy, you might be interested in this one. Western Victoria Primary Healthcare Network Green, a project squarely focused on demonstrating the co-benefits of caring for people and the planet in unison. I don't want to reinvent wheels. I need to connect all the best practice happenings to create a vulnerability assessment to the region to enable us to build agility, capacity, education around better health outcomes. Please contact me if you can help. Lee Penny. So I think you've just found a new best friend.
Yeah. That's great. I'm not sure of her contact details, but I might get in touch with Linda afterwards and get your contact details, Penny.
Yep, great. Yeah, go for it.
Sorry, this is the crafty climate loose change cafe. What it basically is, it's a traveling sort of cafe that like goes around to like markets and like festivals, and like there's paint. People can sit down, have a coffee, but there's paint. They can paint their worries about the world. Gosh, there's a lot of them. All those works can go towards like an exhibition that can be sold, or have an exhibition about the climate, or people can just paint, because art is just a really great way to express all your creative and collective anxieties about the world. Anyway, you also get a coffee, which is paid for in whatever loose change you have, and all that money goes towards planting trees. Involving various different groups, but you could work with the Australian Conservation Trust of volunteers to do this, or other areas. It's a great thing. But bottom line, coffee. There's a lot of coffee involved, but it is the crafty climate loose change cafe. There you go. There was one.
Excellent. Thank you so much.
If it doesn't exist already, it should, and you should stop drinking coffee. Community-owned solar farm. No current plan, just an idea, successful in a number of communities. Goulburn, Nowra, Canberra. Businesses, orgs, individuals. Invest. Yeah, sign me up. And Greg's definitely going to get involved. So who was that? Who wrote that up? There you go. All right. Community in action, community capital, capacity building, share the workload of health workers by strengthening communities, get to know your neighbour and share the load to support our vulnerable in our community. There's another one for you, Remy. Who was that wrote that one? She's gone. Okay, she's off, ready to change the world. Ross, did you and Alison want to do a quick? Oh, he's gone. Alison, yep.
Yeah, so spoke about their discussions. So yeah, I suppose the last 20 minutes of those of you who are in the room with Ross and I, yeah, I suppose we just kind of spent the 20 minutes discussing what some of the things that we could do to better support vulnerable people with prepare and adapt to climate change. And so there were some really interesting discussions that came out, which has all been written up on some post-it notes over there. So I suppose we were thinking, wondering how we can better distribute all that, I suppose, after the forum as well.
Thank you. And if I were to again bring all of this together, we heard from the morning that income levels have direct correlationship with how, they contribute to greenhouse gas emissions, right? Now, looking at vulnerable and the reason, there is significant underlying poverty that exists, right? Now, what did the presentation say? That people who are poor or are underprivileged do not contribute that much to climate change, but the impact on them is significant. So we have to do our share, and there has to be that equity framework applied in taking care of people who are vulnerable. That is a really great message that is coming out, because 12% of the people in our community live under the poverty line. And right now, when you look at the cost of living crisis, that is impacting them even more severely. And combine the health impacts of climate change and the way it is disproportionately going to affect them, there has to be significant actions that we take in protecting the vulnerable people in our community. So I think that is something that we're hearing loud and clear from the morning till now.
Ashish, sorry, can I ask a question to Remy?
Yes, please.
Remy, I just want to touch on a point that you made around climate change deniers, or those that don't believe climate change is real. So in Warrnambool, we're quite a conservative community, and in some of the advertising that I saw for this forum on Facebook, there was a number of people that wrote on the advertising page that climate change isn't real. I don't trust anything from the World Health Organization. It's a crock of shit. As well as Warrnambool isn't, I don't know, compared to other areas across Australia and across the world, probably not seeing the huge effects from climate change at the moment. Like, we don't get that many days over 40. There's not as many sort of, I guess, huge floods or disastrous bushfires here. So the topic of climate change isn't hugely discussed. Have you seen any sort of, I guess, ways that we can raise the topic of climate change in a very conservative area where there's quite a few people that don't really believe it's an impact?
That's a really good question. There's a few things, there's a few different threads there, but I mean, one of the things, social media is designed to, I don't know, facilitate discussion. And unfortunately, one of the things that does that is the divisive people who sit on there. And the people who believe in climate change are never going to comment, oh, I believe in climate change for every out of 10 people, about 1 in 10 in Australia don't believe in climate change. And of course, in some areas that might be higher, and that it is slightly higher in regional areas, but also people in the regions tend to be more exposed to the impacts. So people, you can see the places that are really impacted. For example, Western Sydney with crazy heat, or you might see like Eastern Victoria with the bushfires or the cyclones in far north Queensland. But Warrnambool will be, Southwest Victoria will be affected. And we also, we don't live in a community where we only care about the people in Southwest Victoria. We've all got family, most of us, around the world. And in different parts of Australia. So we also want our loved ones to be safe everywhere. In terms of communicating with deniers, the first thing to remember, it's really hard, but your audience isn't them. If you come into contact, it's a bit dramatic, but if you hear people spouting denialist points of view, the first thing to establish is, do they actually believe that, or are they saying something that they've just heard bandied around? If they really believe that, it can be hard to do, particularly if they're a family member, but honestly, it isn't worth having the conversation with them. They have a fundamentally different point of view, and they need to sort of accept it within them before they're going to be able to have a good conversation with you about it. What's more important is to talk to the people who are persuadable. So roughly speaking, there's 10% of people who deny climate change and about 50% of people who are really convinced it's a problem and aren't going to listen. That still leaves about, say, 40% of people who don't really think about it that much and can kind of be persuaded either way, depending on the messages that they hear from the people around them. So you don't have to convince anyone to care, but by saying that I care about this, that sends a message to the persuadable people in your life who are maybe not super passionate about climate change, or maybe haven't worked out how it might affect them and their life. But by saying that you care, they will start to care because they care about you. So your audience is not the deniers, but your audience are the people who don't really tune into this issue. If you don't talk to them about it, maybe what they see are the denialist comments on Facebook, and that's the only message that they're hearing about climate change. So yeah, I would encourage you to talk about why you care about it, and people will follow along with you. And yeah, don't spend too long in comment sections. They are cesspits. But yeah, thank you for the question.
All right, thank you, Remy. Let's go on to our next presenter,
I'll pop off. See you guys.
Grace Cosgrave-Gam. Thank you, Remy, again. So Grace is a program alumni of our Green Futures Now program, which is implemented by Warrnambool City Council for people aged 12 to 25 to build knowledge and active participation and solutions to address environmental issues. Currently studying a Bachelor of Environmental Science at Deakin University in Warrnambool, Grace completed her Bachelor of Environmental Science in Marine Biology in 2022. Grace moved to Warrnambool to study at Deakin from East Gippsland and was part of the first Green Futures Now program in 2021. Grace is working at developing a project based around the information captured by baited underwater video systems that have been deployed off the Victorian coast. For the future, Grace would really like to see scientists, managers, and communities continue to work together to protect and mitigate the impacts of climate change that is going to have on our environment. Welcome, Grace.
Thank you. So before I begin, I'd like to acknowledge the traditional owners of the land on which we're gathering today, the Gunditjmara people, and pay my respects to the elders past, present, and emerging. So my name is Grace, and I'm going to talk a little bit about the Green Futures Now program run by the Warrnambool City Council. So the program's aimed at young people and including their voices in the broader conversation around climate change adaptation and mitigation planning. So I was a part of the first program that was run in 2021. So the general structure of the program is that a group of young people go on 3 days of intensives where they are connected with community members who are working to mitigate, adapt, and respond to climate change. Could I get a slide change, please? Thank you. So some of the organisations that we met with during our intensives were the Warrnambool Community Garden, Warrnambool Coast Care Land Care, Mad for the Marai, Beach Patrol, One and Water, the Glenelg Hopkins Catchment Management Authority, Nature Glenelg Trust, and HiCell. Following these intensives, young people are supported to develop a project that addresses climate change and broader environmental, oops, no, it didn't change that. Broader environmental issues that they have identified. During my year, some of the key aspects we identified were educating people on what local community is doing concerning climate change, sparking people's interest and engagement in local community groups that are involved in sustainability, educating our peers so that they can make climate change less of a risk in the future, and supporting young people to include environmental sustainability in everyday life as a habit. We had some pretty grand plans for our first project. Initially, we were considering a sustainability fair and an art competition to see who could make the best art piece out of recycled materials. However, the COVID-19 pandemic meant that it would be really difficult to deliver this project in the time frame that we had. So we came up with a few different ideas that morphed into the project that we presented. So we worked with a local videographer to create 6 interviews where we talked to community groups and artists about what they do, why they do it, what they are trying to achieve, a sustainable action that anyone can do to support them, and what their dream green future was. We also wanted to make living sustainably more accessible to young people. So we created what we called Living Simply packs. These contained reusable and sustainable products like reusable straws and shampoo and conditioner bars. These were awarded to young people through a council-run competition and handed out at the Warrnambool Climate Rally last year. As we were the first year of Green Futures to be run, we were also very lucky to help come up with the logo for the program. We wanted something unique, easy to identify, and something connected to Warrnambool and the environment. Eventually, we came up with the idea of using the Fletcher Jones water tower for the basis of our design. It is identifiably Warrnambool and pretty unique. So yeah, that's generally where we got our logo from. Hopefully everyone knows the water tower and can sort of see where we're coming from. So my participation in the Green Futures Now program has helped me to understand the breadth of action that is being taken both in the wider community and in the council in the climate change action and the support of young people. I'm currently doing my honours year at Deakin, and I'm working on developing a project based around the information captured by baited remote underwater video systems that have been deployed off the Victorian coast. No, that's all good. So the footage that you saw briefly there was from a camera that's been deployed in the Apollo Marine Park off Cape Otway. And that showed a 7-gill shark that does have a hook in its mouth, unfortunately. So one of the things I'll be looking at in my project is how people are affecting our fish communities. We're back. So the plan at the moment is to use environmental, habitat and anthropogenic variables to find out what is impacting the distribution of fish and differences in fish community structures along our coastline. So I'll be including factors like distance to coast, sea surface temperature, habitat type, depth, distance to port, and population on the coast to model what is impacting our fish communities. For the future, I would really like to see scientists, managers, and communities continue to work together to protect and mitigate the impacts that climate change is going to have on our environment. I would really like to see young people continuing to be involved in the conversation around climate change and being recognised as an important aspect of how communities are going to respond in a changing climate. Ultimately, for the future, I would like everyone to do what they can to look after our environment. I think that the Green Futures Now program is particularly important for young people. in the engagement of young people with the council and showing that our voices are not going unheard and that we have a valuable perspective to add to the ongoing effort to adapt and mitigate the impacts of climate. I also think that it is an important thing in a society that is just recovering from the COVID-19 pandemic to facilitate the connection between young people and the community. The pandemic years have really changed the way we communicate, and it is important to be able to form connections with our community. Thank you.
Any questions? Okay. Well, thank you so much, Grace,
Thank you. Goodness.
for you. And please put your hands together for Lauren Brown, who is the manager of this program, who runs the Increase Now program. Lauren? Our next speaker is Dr. Rebecca Patrick from the School of Population and Global Health at University of Melbourne. The title of her topic is Keeping the Future in Mind, Promoting Mental Well-Being in a Climate-Impacted World. Dr. Patrick is a climate and health researcher in the School of Population and Global Health at the University of Melbourne. Do we have Dr. Patrick online?